Howdy, my name is Frankie Jackson. I am the coordinator of the LGBTQ plus Pride Center here at Texas A&M University. I am going to be joined today by Dr. Matt Hoffman from the nursing school. And I am just going to go ahead and get us connected.
Just checking. Oh, there he is.
Hi,
Hey, Matt, how's it going?
doing pretty good. Can you hear me okay?
Yep, we can hear you good.
Sweet.
Alrighty, so again, my name is Frankie Jackson. My pronouns are they, them. I'm the coordinator in the LGBTQ plus Pride Center here at Texas A&M University. And today we have a very special Facebook Live with Dr. Matt Hoffman. I will let you introduce yourself.
Hey, everybody. I am Matt Hoffman. I'm a clinical assistant professor in the College of Nursing. I'm a family nurse practitioner. I use the pronouns he, him, his. And I've been with the university since about 2012. And I have a family practice clinic here in Bryan College Station, where I've been trained in primary care, but I had a lot of specialized training in hormones and integrative medicine. So that's kind of where all of my expertise and experience comes in terms of gender affirming hormone therapy. Yeah.
Matt has also spoken with us several times. He was on a Pride Live where we talked about LGBT health disparities earlier in 2020. Matt sat on a panel about the AIDS epidemic when we did a movie 5B, not this past October, but the October before that. So if folks do have some questions, we do have a pretty great knowledge base here. So we always enjoy talking with Matt. And he seems
Same
to come
here.
back and doesn't mind us. So.
Absolutely not.
So we are going to jump into our questions. And so the first one we wanted to ask is, how can I talk to my doctor about gender affirming hormone therapy?
You know, I love this question because it is really just a foundational point to start. And I think that there are some subtle nuances that kind of lead into this. Sometimes there are hints that your provider may subconsciously already give to you that it may be safe, or maybe you don't want to talk to this provider about it. You know, for example, anything as small as making those assumptions that your partner is of the other gender. Those types of assumptions where they've actually not bothered to ask to get to know you, to something more blatant and rude, I won't put it any other way, of just completely misgendering you if you've already made your pronouns known or name or something along those lines. So I think that everybody can already have some sort of barometer as to their comfort level with approaching a provider. There may be certain individuals within that practice that you feel comfortable with, but it's not necessarily the same vibe that you get from the person that's providing care to you. So I think that if there is an established relationship, you know, I'm all for people staying where they're comfortable being, and not really feeling like they're trapped, because there are plenty of providers out there. You can just look and find someone else that takes your insurance or someone else that you click with. So essentially, if there is somebody in the practice that you feel comfortable with, ask them, because it's likely a medical assistant, an LVN, a nurse of some sort, that you could say, hey, I'm kind of thinking about this. What do you think the doctor would, you know, whomever it is, what do you think they'd think if I were to ask about this? And, you know, there are some limitations legally with HIPAA in terms of whether or not a provider could say they see other, you know, individuals for hormone affirming therapy. But it's one of those things where you don't know until you ask, and you may already know whether or not you feel comfortable or safe asking too.
Yeah, absolutely. I think that's a great point about asking nurses or other folks who are there. You may feel less of a power dynamic, but we know
Yeah,
nurses do a lot of that patient care, so
yeah,
you may be a little bit more
absolutely.
comfortable there.
Yeah, absolutely. And if you think about it, the role of a nurse, it's really actually what got me into nursing was the amount of time I lived with my grandmother whenever she was in her final years, and I was her primary caretaker essentially. And I would take her to doctor's visits, and it was always the nurses. If, you know, I was in high school, if I had a question about one of her medicines or some of her symptoms, I would call the office and talk to the nurse. And so that's really where a lot of the connections were. And that's where I felt like I want to be in that. I want to be that kind of person that can help, that you can go to with questions. And it's been absolutely rewarding since then. So that's my story of becoming a nurse in a nutshell. So,
Oh my gosh, I didn't know that. We're
yeah,
learning beautiful things about
yeah,
Matt too today.
yeah. I'm sharing. Sharing is caring.
Oh, thank you.
Yeah.
All right. So we're going to get into our second question, which is what can one do if they don't have insurance or if my current insurance doesn't cover GAHT?
Yeah, so the GAHT, if no one's familiar, Gender Affirming Hormone Therapy, and it's one of those, the more common questions, honestly, that I get. There are a limited number of insurers that actually will cover hormone therapy, and a lot of what I've seen personally, and again, this isn't global by any means, but what I've seen in my practice is a lot of the insurance companies that do cover those types of therapies are specifically ones that come from larger, more blue states, if you will. And
Okay.
so, you know, those types of companies, as opposed to, you know, just for example, and I'm not saying anything negatively, but like at the university, we have Blue Cross Blue Shield of Texas. So it
Sure.
might be a Blue Cross Blue Shield of California or one of those other states is the example I'm trying to give. And so one of those things is you have to ask, and it's just another thing that you just don't be afraid to ask, what are cash pay prices? A lot of clinics are really forthcoming with that type of information because honestly, we like cash pay patients because we don't have to deal with insurance. There's a lot more flexibility that we have in being able to see a patient and say, okay, if you need X, Y, and Z, this is how much it's going to cost versus with an insurer, you know, there are a lot of hoops we have to go through in terms of pricing and all of that type of stuff for reimbursement. So cash pay is actually something a lot of providers look forward to helping patients with. Additionally, the other thing that people have to consider when we're looking at cash pay, it's not just the actual cost of the visit, but you have to consider when we're looking at hormones, we have to make sure that biologically every part of the person is safe for us to administer these hormones, to provide them to. So there's lab work that's involved as well. So getting costs and prices about lab work and asking about that. So if you get one number, ask them, is that for the visit or does that include lab work costs as well? The third expense is the medication. So the expenses can build up over time, but again, I use GoodRx for a lot of patients that are uninsured. It's an app. I have cards in my office, and with my EHR, I can actually send patients a coupon for their medication via text. And so it's really, really helpful. The good news is that a lot of the mainstream hormones that we do use are generic. So the cost is, you know, if you're getting, I had a patient once that had said the pharmacy charged them like $60. And fortunately, they were able to pay for it. But I was like, that is way too much. You should never pay that amount for your hormones. So let me tell you about GoodRx. And so the costs can come up, but you know, in my particular practice, for example, I have an account with a local lab where they bill me specifically, and I can offer a reduced price to patients for their labs. So, you know, I do everything I can to provide a cost saving to patients. Kind of good healthcare dollar stewardship is an important component to me. So we're not adding expenses to the exorbitant healthcare environment that we live in. But that's a couple of the other considerations, because a lot of people say, I want to get on hormones, but they don't think about some of these other hidden costs. Additionally, the cost of follow-ups, like how frequently are you going to have to be following up? What would that cost potentially look like? Those are the types of questions. But again, it's calling, talking to someone. In this case, it's usually an office manager or someone along those lines that can give that information. But these are the questions that people need to know about so that way they can ask and get the information. And I think the other thing that's important for me to add is shop around. You know, you kind of get what you pay for. And so, like I said earlier, if you don't click with the provider and you think that you're just paying a whole lot, look for somebody else, see what you can do. For the longest time, I've had a lot of patients that have told me they traveled from Houston or Austin to get their hormones. And when they found me, they were so happy because now they didn't have to drive as much. However, if you have family in Houston, Austin, those larger areas, and you're already traveling there, that could be something that you could consider looking into as well. Because if you're already planning to go home, go visit friends or something, schedule your follow-up while you're there. There are plenty of options, and definitely shop around.
So you bring up Houston, Austin. I know this wasn't like a pre-selected question, but I think Planned Parenthood provides some of these transitional services, and there are, and I know, so we don't have a Planned Parenthood in the Bryan College Station area for folks, just to be aware, but there are Planned Parenthoods in Houston and Austin and Dallas and some of our bigger cities here in Texas. Do they provide some of that care?
They absolutely do. And the interesting thing that in my experience, I'm so glad that there are these services available through Planned Parenthood. It's just one of the many wonderful things that Planned Parenthood does. I'm big team Planned Parenthood, if you can tell. But the thing is, sometimes there's not consistency in terms of the care provider. And I've had patients that in the past have said, you know, I saw one person and they were great. And then the next time when I went in for my follow-up, I saw somebody else. And I wasn't quite sure that I knew that they knew what they were doing. Not that they disrespected them or anything, but there was just not a comfort or a familiarity with that individual that they'd already established in the past. So I think that's one thing that if you do go to these places, like Planned Parenthood anywhere, just make sure that you're scheduling with the same provider, because that's not always something that, you know, even in a regular family practice that might just be around the corner, you might not necessarily get the same provider every time. So just double check whenever you're scheduling.
That's a great point. Thank you.
Yeah.
So what can one do if my doctor is not supportive with beginning gender affirming hormone therapy?
Yeah, that's another good question. You know, what I've seen and heard from patients is a lot of times the provider's just not comfortable with it for one reason or another. And we have to kind of look at a little bit more of the global system whenever we consider that, and not just pin it on the provider. For example, a lot of the healthcare organizations nowadays, it's just kind of naturally evolved into this. They're religiously affiliated. So for example, we have CHI St. Joseph, Catholic affiliation. Baylor, I believe, is Methodist. It might be Baptist. I'm not sure. It's one of those. But again, it's however, the Baylor system, it's not as in your face as the CHI system is, not to diminish the care that CHI provides. I will say transparently, I am a CHI patient myself. So it's one of those things, but I've had patients that, you know, they don't appreciate or don't feel welcome in a religious type of setting. And so that might not be the place for them for that obvious reason. But to speak to your question, globally, some of these healthcare systems may not allow that type of hormone treatment to occur from their providers. So I think it's not a secret that CHI, as I said, is Catholic, and within the Catholic faith, they don't permit birth control, right? And so birth control is estrogen, progesterone, these combination types of medications that we might be providing. So again, it's very, it's different. I'm happy to report though that I've had providers from within the CHI system that have reached out to me in the past and have said, hey, I've got a patient, I can't do this. Can you see this patient? And I'm happy to, whenever I'm taking new patients and available, to see them. So again, it's not one of those things that just because they can't see them, that doesn't mean that they won't help by any means. And so I do share patients where I just manage the hormones and they see their primary care provider at Baylor, Scott and White, CHI, whatever it may be. And, you know, that's just an instance where the primary care provider does help. They do reach out and they do want to make sure that their patient's happy.
Awesome. Yeah. I
I
mean,
know.
people get referred for all sorts of things, right? Like it's
Yeah,
not just gender affirming, surgery
yeah,
or hormones. So,
yeah,
people do get referred for things that,
for sure.
are all sorts of fun stuff. So,
Yeah, totally.
all right. So what resources can one use to find more affordable or accessible clinics?
So, in terms of the clinic side, I've heard so many stories from patients that I like to ask, how'd you hear about me? And sometimes it's through public events like this. Other times, people said, I just searched LGBTQ plus friendly provider Bryan College Station in Google, and boom, you popped up. There are directories, so Google is one place you can look, just a generic search along those lines. There are professional organizations like my only beef with them is the name. It's the Gay Lesbian Medical Association. So it's kind of exclusive, GLMA, but their directory is exceptionally great in that it does kind of list subtle like specialties, if you will, whether or not it's anything from psychiatry or psychology to hormone therapy, as well as surgery. So that's one of the directories that I'm affiliated with and on. And so it's definitely one of the primary resources that patients have found me on as well, but it's not exclusive. I think the other kind of thing that we have to make sure we consider is word of mouth. You know,
Yeah.
there are so many patients that I have had that came to me because their friend came to me or their friend heard about me and they're not even my patient. I've heard of that. So I'm just like, okay, cool. Yeah. It doesn't matter where someone hears about me. I'm just happy to help. So again, word of mouth, find out who your friends are seeing. And I know that within speaking specifically to the trans community, I know there's a lot of online activity, be it in Discord or message boards or wherever, that people are meeting each other and learning about their experiences and sharing. So get connected into one of those if you're not already and find out where people are going. But it's, if you've got a circle of friends, I would hope that someone wouldn't send you to a staunch conservative practice or something along those lines, especially knowing what your specific needs are. But it's
Yeah. I mean,
usually,
that's
I kind of think of if you're friends with someone, you have something in common. So
mhm.
hopefully they'd be able to send you somewhere that you would like, even if it's their provider or not their provider.
Yeah, I recently moved to Bryan College Station like a year or two ago, and all of my doctors and therapists and stuff have been recommendations from friends and stuff.
Yeah,
So that
see, it's
has been awesome.
perfect. And the other thing that's great for our students here at A&M is the resources both in Butyl as well
Yeah.
as CAPS. They know they have lavender lists. They have you guys
Hmm.
have compiled a lavender list as well of individuals that have come together and said, yes, I do provide LGBT friendly care. And so you can reach out to any of these organizations. And if you're getting ready to graduate, I know that Buryl's really good about saying, hey, you're going to want to continue this therapy. You're graduating at the end of the semester. You might want to go ahead and establish with somebody else. Here's who we have that you can look into. And so, don't forget your university resources as well.
Yeah, and that's an important point for all of our graduates, not just our trans ones, is that you may be receiving some sort of prescription or care through Butyl or through CAPS and stuff. And so thinking about that transition after college so that you're not left without resources when you graduate in May or, when you
Yeah,
graduate, is that transition
absolutely.
into the community and stuff. So
Yeah, and
great.
to give CAPS a shout out real quick, one of the things that we're seeing equally difficult in terms of access to care is the care in terms of counseling, therapy, et cetera.
Yeah.
Fortunately, I try to find silver linings. So one silver lining to the pandemic has been that a lot of counseling and therapy sessions have become much more readily available online. The
Hmm.
format can be a little bit different for individuals, but if you've never done counseling or therapy before, and this is what you get to know, that's totally fine. It might just be secondhand to you and you don't have any problems with it. But I would say that especially if you're seeking counseling, receiving therapy, any type of assistance through CAPS, start looking for that before you graduate. Kind of try to get that transition of care a little bit sooner secured, so that way you're not left without the help that you need, because I've been there as a new graduate. The world is crazy. You don't have this university support system anymore, and your support system might be smaller. It may feel small, but be a little bit larger than what you feel it is. It's one of those things where I want to make sure that everybody kind of has as much support as they need.
Yeah, I mean, with a lot of trans healthcare, when we think about transitions and surgeries, letters are required. I'm not sure if that's a state one, but it can be clinics have different requirements. And so thinking about those things like, do I need a psychologist note? Those sorts of things are just really important to think through our transition process, because it's not just hormones. Medical transitioning is a huge array of different services and things folks may choose to go through or not go through, depending on access and, health and other stuff like that.
Yeah. And I think it's important also when we're talking about hormone therapy to, I share this with all patients. It's ideally, in theory, it should be lifelong. However, some people, for certain reasons, decide they want to stop them. It's kind of like, I'm happy where my body is right now. I want to just kind of stop and see what happens, kind of just feel this out. But I want to just freeze this moment in time, and then we can look at starting up hormones later on if I need to. But that's kind of one of the things that a lot of people don't consider. And as you said, it's very nuanced. The time that you would either start with getting your hormone therapy or start pursuing out surgeons or those letters that you might need, it's different. And there are recommendations as to when, how all of this falls. But I tell everybody, this is your journey. There's no prescribed way. If you're in a Discord group of, have a group of friends that did it one way, that doesn't mean you have to do it that way. Everyone's resources are totally different. And additionally, if it's one of those things where you have an insurer, that provides all of these services, will cover everything up to surgery included, if that's your end goal, but you don't see yourself with the company forever, use the benefit while you're there, right? And then just kind of say, this is my timeline. I'm going to use this benefit, stay in this job until this point in time, and then move on. So again, the process is totally different for everybody. There's nothing that's prescribed in terms of you have to do X, Y, Z in this order within this time frame. So I can't reiterate that enough, because, we hear things from our friends, we get excited, we want to have it happen fast, but this is not something that innocuous. I mean, it's innocuous in terms of how it occurs, but it's one of those things that it definitely does not occur fast. We have to take our time to be safe. And that's really the ultimate end goal, is to keep everybody safe while getting them the care that they need.
Yeah, absolutely. 100%. Thanks. How can allies help in improving healthcare access, or just, help in this process, right?
Yeah, I think that kind of what we'd mentioned earlier in terms of sharing availability and resources. For example, I have a colleague that I absolutely adore, such a wealth of information and knowledge, that shares information and forwards me emails to share with my patients. And that colleague is an ally in the community. And it's one of those things that, I think that it's a wonderful service that she's offering to me, just in case if I've not seen or heard about something, either the guideline change, conferences, new services that are available, just sharing the wealth of knowledge of what is available, what's happening, especially within the community. I think that, we have so many services. I hope that people that are allies tell students about the center, and just making sure that everybody is aware of what's available and sharing stories, because we learn from each other. And it's just kind of innate human component to connect with others and to benefit from that connection.
Yeah.
And it's kind of difficult in this COVID state, but, with social distancing and all. But again, the internet has permitted us to have connections that we wouldn't have otherwise had.
No, yeah, you may. Go ahead.
Go ahead.
I mean, you've made it on other platforms that we've talked about telehealth, right? Like this is this
Hmm.
new thing that we now have a lot of access to. And I think about our folks in rural areas who may not have always, and internet is still a thing, but like may
Yeah.
not have had access to gender affirming therapy and stuff like that. And that can be such a helpful part of the process. But again,
Hmm.
like if you're on social media and you see stuff about prep, hormone, like those sorts of things that are reliable. We want to share good
Yeah.
information from good sources. But if you see that, yeah, like feel free to like share and tweet those sorts of things so that, you know,
Absolutely.
folks are more aware.
Yeah, one of the new things I think someone had shared it on Instagram, I believe, and it came across my feed, and it was a service that essentially offers scholarship type, merit-based scholarship kind of
Mm-hmm.
services for individuals seeking gender affirming surgery. And so it's one of those things where I had not heard of that before. I was like, I love, follow, like, I'm just like, yes, okay,
Mm-hmm.
excellent. And I've already shared that information with the patient. And so it's one of those things where the more that we share, the more that we connect, it's really, really going to help.
Yeah, 100%.
And I think anybody that is an ally, thank you, thank you, thank you. Keep doing you in whatever capacity you can do. Because again, everything, no matter how small, it may be huge in another person's eyes.
Yeah, absolutely. So those were all of our pre-written questions. We haven't been getting any in the comments, which is fine. So I just wanted to give you a chance to make any closing statements or thoughts.
Yeah, I think that the thing that's been really problematic because of COVID that I've experienced lately has been the issue with actually having access to surgeries because we know depending on the number of infection rates, et cetera, surgical centers have closed down for elective surgeries. So that is something that has unfortunately impacted patients that are on lists and are pretty much ready for surgery. They just have their date scheduled and they're waiting for that date to get here.
Yeah.
Unfortunately, that has impacted things. And I hate that that's the state of the system because, like I said, it takes a long time. It usually does. And, when I say it's a long time, that's my perception, but I can't imagine how long it seems for someone that has been waiting seemingly their whole life to be able to have this experience. And so I can't even imagine, but it's one of those things that patience really is one of the best things that anyone can kind of bring to the table. Just remember that, and as much as you can, be thankful for what you've gotten so far, where you've come, and just kind of look back at the journey and get excited for what's ahead. Unfortunately, COVID has really just kind of thrown a wrench in some of these aspects, but we do have ways to continue to move forward in most aspects of gender affirming hormone therapy. So like right now, I see new patients in the office. They do have COVID screens, so they're not symptomatic or anything along those lines. But medication lab follow-ups, those can all happen via video conferencing. And so a lot of providers are offering these similar types of services in their clinic. So don't let COVID hold you back. As far as I know, the only thing that's really been impacted so far is the actual surgical component, and depending on whether or not those elective procedures are on hold at the time.
Mm-hmm.
And you did mention other references again or other resources, and like I said, I mentioned it earlier. GoodRx. This is available for most prescriptions, not just gender affirming hormones. So if you have a medication that is a known generic, go type in your pharmacy. It's a really easy to navigate website and find out how much you might be getting it cheaper. The only difference is that particular process doesn't use your insurance. So if you have like a prescription insurance benefit that you have to meet a certain deductible, et cetera, those prices are not included towards that because it's not filed through insurance. But again, if you're uninsured, that's a tremendous savings for a lot of individuals. I'm a big GoodRx fan too.
Mm-hmm.
Yeah.
All right. Well, thank you so much, Matt.
Yeah, thank you. It's been fun always. See ya.
See ya. Thank you all for tuning in to our conversation. If you enjoyed it, we will be having more throughout the semester. We also want to encourage folks to sign up for our newsletter and attend future programming. Thanks, y'all, and have a good day.